My key performance project for SPA 362 will cover Meniere's disease. By the end of this presentation, you will understand what Meniere's disease is, the symptoms, causes, the overall diagnosis, and who can develop Meniere's disease, and lastly, the treatments. Meniere's disease is a disease of the inner ear. People experience extreme dizziness, also known as vertigo. It can lead to a permanent hearing loss and affects only one ear. However, I did read that over time it can affect the healthy ear as well. So here I have two pictures. One is what a healthy inner ear would look like, and the second picture is an inner ear with Meniere's disease. In the next slides, I'll explain the science and mechanics behind everything. I just wanted to show the class how swelled up everything is. It's all that backed up fluid that leads to the swelling and pressure. All this swelling can distort balance information, sound information, and that distorts the information that travels to the brain. But of course, I'm going more into detail in the next slide. Excessive fluid buildup is mainly what causes Meniere's disease. So the fluid buildup stretches the vestibular membranes that separate the compartments of the inner ear. All of that fluid buildup can cause a rupture, and that causes the vertigo that people do experience. And of course, these fluids in each chamber should not mix. Salt, caffeine, and alcohol are all three things that can trigger the vertigo attacks. So reducing salt in the diet does help control water retention. Caffeine worsens the tinnitus, and alcohol makes symptoms worse. So some symptoms that I talked about already would be vertigo, which is a sensation of a person is whirling or spinning. Tinnitus, which is ringing, roaring, or hissing in the ear. Hearing loss, which again can happen in both ears, but usually only affects the affected ear. And sound sensitivity. An ear, nose, and throat doctor would usually diagnose Meniere's disease. There is not a specific test, so they would look at the patient's medical history and if they've experienced the following, which is tinnitus, feeling of fullness or a lot of pressure in the ear, 20-minute or longer episodes of vertigo, 2 or more episodes that last around no longer than 24 hours, and temporary hearing loss in the affected ear. So there is 3 stages to Meniere's disease. The early stage, people would experience periodic vertigo attacks, an increase of tinnitus, fluctuating hearing loss in the affected ear. The middle stage, they would experience less severe vertigo attacks, but they are it does happen more often. Permanent hearing loss can develop and the tinnitus is increased. And then the late stage, they would develop hearing sensitivity. Hearing impairment is no longer fluctuating, it's more significant now. The vertigo is now more constant, and now there's more constant vision and balance difficulties and more constant tinnitus. So, can anyone get Meniere's disease? It usually happens to adults, older adults, so between the ages of 40 and 60. However, it is still possible to develop at a younger age. It is treatable. There are various methods of treatment for Meniere's disease. However, there is no true cure. So the types of treatments would be medical and surgical. I did read that there is some at-home remedies, but I didn't want to include that in my presentation, so I'll just discuss medical and surgical treatments for Meniere's disease. So the medical treatments would include medications prescribed to reduce vertigo and the nausea that it may cause. Medicines can also be prescribed to shorten the dizziness attacks. Dietary restrictions, like I mentioned earlier, reducing salt, caffeine, and alcohol intake. There's also injections in the middle ear that helps control the vertigo. And then, of course, a hearing aid. Now moving on to the surgical treatments. This is used if all else fails, surgery is an option. So the procedures would include, please note, bear with me, I'm gonna have a lot of trouble pronouncing these words, okay? So the first one would be intratympanic steroids, which are steroids that are injected into the inner ear to reduce hearing loss and dizziness. Endophthalmic shunt surgery is where they will drill a hole in the inner ear to prevent fluid buildup. They place a shunt to drain all that excess fluid so it won't swell up and eventually rupture. And that works about 80% of the time. And now a labyrinthectomy is the removal of a small amount of the bone in the inner ear, or opening the inner ear and demolishing that soft tissue. This works about 95 to 98% of the chances of a vertigo attack. So it may end the vertigo attacks, 95 to 98% chance of ending them completely, which is pretty high. And then lastly is the vestibular neurectomy, which is the last option. So if all of the other things fail, they're going to this vestibular neurectomy, which is a procedure that cuts out the balance nerve from the brain. So yeah, that's why it's the last option. And yeah, that brings us to the end of my presentation. I hope you guys have a better understanding of what Meniere's disease is. If you still have some unanswered questions, if something was a little confusing, please feel free to check out all these references. They were very helpful.